In this video, I'd like to go over some medication labels and how we can pick out the important pieces that we will need to calculate correct dosage in this course. So first of all, I'd like to point out that if you are using or going over this video to learn everything about medication labels, that's going to be a mistake. My recommendation would be to get out your dosage text that we use for the course, go into the chapter, and really learn what these things are. This should just act as a summary. So the first thing that you might notice on a label is the title, right? What is this drug that we're using? And you'll actually notice there are two different titles, two different names. In this particular, or on this particular label, we have Concerta, which we would call the brand name. The brand name, very similar to Tylenol or Advil or Motrin. These are companies who actually have the ability to brand their manufacturing of that drug. Underneath that, we have what's called the generic name. And in this example, we're working with methylphenidate, and HCl is hydrochloride. So if you think about, for example, Tylenol, that's just acetaminophen. If you think about Aleve, that's naproxen. So both names, Aleve, naproxen, that's brand name is Aleve, the generic name is naproxen. Now, those are two things you want to keep in mind relative to the name. Am I dealing with the brand name or a generic name? Now, you also want to consider specific ways of how you're going to give this drug. And in order to do that, we have to think about what is this label on? What type of medication are we actually giving? And in this example, we're giving tablets. And that's really important. You need to consider what is in this. Are we dealing with a liquid? No, if we're dealing with a liquid, you might see that this has 5 milliliters in it. Or if we're dealing with some weight, this might say, 250 milligrams. All right, so in this particular example, we're dealing with tablets that we're administering, and you'll notice the dosage strength. This is the dosage strength, also known as the concentration. This is going to be potentially one of the most important pieces that we'll use for dosage calculations. And this is 36 milligrams per one tablet. Absolutely, you will need that information in this or on this label. Some other things I want to point out. If you look over here to the right, you're going to have manufacturing instructions or manufacturing information, and also down below we have manufacturing information. Above the manufacturing information, you're given storage information. So does this need to be kept in a refrigerator once open, or does it need to be kept in a refrigerator all the time? We're dealing with tablets here, so this is saying to store at 77 degrees. So this is storage information. Other things, up at the top in the center, the Ndc number. The Ndc number is a way to itemize. This is a guideline by the FDA that every label, every drug needs to have this Ndc. So just in case something was unreadable on this label, you could look that up in a catalog to really see what is in this bottle, or in this case, it's a bottle, or if we're talking about a vial or something like that, a bag, whatever it might be, this is a way to look up what is this drug. The final thing I want to mention is this piece right here. C with a 3 inside. This is telling us we are dealing with a controlled substance. It is controlled. And that's going to be designated by the FDA. Let's look at the next page for some more examples. On this page, we're given 2 additional labels, and I'm asking you to find 4 things. What is the generic name and brand name? How do you administer this drug? What route? What is the dosage strength or concentration? And are there any particular instructions that you need to follow? So if you're watching this video and you're going over the guided notes, I would pause the video and see if you can answer these 4 questions. Find the important pieces that satisfy these questions on these 2 labels. Once you're done, go ahead and hit play and see what you found with these labels. So for both of these, the generic name and brand name, that's typically more straightforward, right? Here we're dealing with Ambien. That is the brand name, and usually in parentheses or right below it, the zolpidem tartrate, this is going to be the generic name. All right, so another question we might ask is, how would you administer this drug? Well, that's going to depend on what we're looking at. Now, what is in this container? I see at the top that this container contains tablets, right? So that's telling me this is going to be administered by mouth, right? This is going to be an oral drug because we're dealing with tablets here. The other way you know is by looking on the side. We're kind of jumping ahead of ourselves here. But this is also going to tell us, these are instructions. We're talking about tablets, all right? We're going to be consuming tablets, 1 or 2 tablets at bedtime. So that is going to be by mouth. What is the dosage strength? Right here in the middle, we're dealing with 5 milligrams. These are 5 milligrams per 1 tablet. Are there dosage instructions that need to be followed? Well, that's what I put in this rectangle over here. It looks like 1 or 2, also depending on if we're given an order that we need to follow, you might, that will dictate whether or not you give 1 or 2. Does the patient need 5 milligrams or 10 milligrams? And other than that, it looks like it is, we would have to check the prescribing information to validate that. Now, I want to go back real quick to this question of what is the route? A lot of students get this incorrect because they see this right here. They see this IV and say this is going to be an intravenous drug. So we need to get a syringe and inject this medication. That is incorrect. If you notice there's a C above that, that's telling you that this is a controlled substance. A controlled substance. You would not want to administer Ambien through an IV. The next label, we are dealing with vancomycin and HCl, which it looks like that's going to be the brand name. How do I know? Usually the brand name is a little bit larger, and right below it, smaller, in a smaller print or in parentheses is going to be the generic name. But if these companies are manufacturing their drugs, they want the brand name to stick out, so that's usually going to be the largest. Now, how are you going to administer this drug? Notice right here in the center, this is an IV, intravenous drug. So we're going to administer this through an IV, through the vein, in a vein. What is the strength? Now, you could look at this and say, well, there's 1 gram. And that's correct. I mean, this contains 1 gram of this vancomycin. However, if you look here on the important instructions here to the left, it gives us what are called Reconstitution Instructions. So it says the usual dosage for an adult is 2 grams daily. But if we wanted to administer this medication, and this is really important, right down here, if we wanted to administer this drug, we would want to actually dilute with, it says to dilute with 20 ml. So this is what we would call a reconstitution. We're taking this powder, we are adding some liquid, we're stirring it, we're shaking it, and it's going to dissolve in that liquid. And it doesn't actually give us a strength, right? It doesn't give us a strength. It is equivalent to 1 gram, and we are adding 20 mLs. So one might imagine this would be 1 gram per 20 mLs. But you would want to, again, check the instructions. Here it's not given to us. It would be a little bit more clear if we were to actually go ahead and calculate how many mLs to administer. And finally, these are exactly the instructions that we would need to follow, right? We would need to follow these instructions here, the Reconstitution Instructions.